Okay, I've got 10 minutes on this YouTube channel. I've got to get through this as fast as I can so I can get you all the information that you need. First up is a disclaimer. This is use at your own risk. All this information is use at your own risk. You are dealing with a deadly neurotoxin called Botox, and I am not a doctor, a nurse, or healthcare professional of any sort. On paper, I am qualified to do absolutely nothing. And so that's kind of the point. The point of making this video is to help people that are like me that are in chronic back pain due to a muscle spasm from typically a car crash or some sort of back injury, in which you now have a muscle spasm that you are typically taking muscle relaxers for and all kinds of regimens that your doctor just pumps out, but never actually offers you to go to a better, longer term treatment, which is, of course, much more expensive, but not nearly as expensive as if you learn how to do this, which is, I'm hoping, will help people. And so the first thing you need to understand is that you are dealing with a neurotoxin, and this is for injecting into large muscle groups such as the back or the shoulders or something of that sort, or even possibly the neck. This is not for facial applications or cosmetic of any sort, because those injections are much higher precision, and the mistakes and consequences of a mistake in those areas are much higher than larger muscle groups in which you have some leeway if you make any mistakes. Still, there are risks. If you hit a blood vessel and inject too much into that, you can have a reaction to that. And so, number one, when you do get your Botox, you do want to do a quick test sample. Typically, they are sold in, this is the 100 is like the most popular thing. Hit yourself with maybe 2 or 3 units and just make sure that you don't have an allergic reaction to it. Use your deltoid, which is your shoulder muscle, and then just have the patience to wait 3 days to see if you had a bad reaction to it, and then that'll be a confirmation that you're not allergic to it. Okay, you're going to need sterile water. Sterile water, nice and clean, whatever. And then you'll need pliers. Ideally, you want to get pliers like this that are sharp, that are angled, and are basically scissors. They're just very strong so that you can pull off, slowly peel off this aluminum retainer that's on the top of the Botox vial. You are going to need 2 different types of syringes. You don't really need this. Okay, there's a 1 milliliter and then there's a 3 milliliter. You don't really need the 1 milliliter, but it's much easier to deal with. The needle is much smaller, and it doesn't hurt as much, but by the time you're watching this video, you've been in so much pain that a pinprick, you're not even going to know. Okay, but the bottom line is you don't actually have to have the larger 3 milliliter. Well, you do need to, actually, I'm sorry, you don't need the smaller needle. You do need the 3 milliliter needle. You also need a marker. You want to use a marker so that you don't have to use a pen. Do not use a pen, because if you use a pen, you can to mark your injection sites, because you do want to feel around on your muscle on where you want to inject, where the most pain is, and then spread out, maybe a spread of 6 in a cross, or however you want to do that. In a straight line is what I do a lot of times. The bottom line is you don't want to create a tattoo by accident if you use a pen to mark your injection sites. You, of course, want clean needles. Never accept anything that is not in its original plastic packaging. This can be a hurdle for you, depending on what city are you in. You might even have to go down to a drug rehabilitation center and say, hey, look, I'm here for your needle exchange program, which most major cities have, because they'd rather you have fresh needles than, die from using dirty needles and all that stuff. That's up to you. Your main hurdle, this is 2021, September 1st, and we're in the middle of a pandemic. And so your main hurdle is going to be getting a legitimate source of Botox, because there's so many scams running around everywhere, and you can't trust reviews either, because those are all fake too. And so your main hurdle is getting a legitimate source of Botox in addition to these needles. After that, you're all set, because sterile water is easy to come by, and the rest of the stuff is too. And so let's get started. When you receive your Botox, the first thing you want to do, as I already mentioned, you want to test yourself if you haven't done this before. And I'm going to share this reconstitution method, the calculations. Reconstitution is just a fancy term for mixing with water. So let's just be honest about that shit. And so what you want to do As soon as you get the Botox in, throw this in your refrigerator. Go ahead and rip it from its box, and then that will give you some time to read up on it if it's in your language. Don't freak out if it's not in the English language, because a lot of it's made overseas and in a better, less cost manufacturing plants, but it is officially still the official product from Allergan. And so then you want to throw these vials into your refrigerator and just wait while you study up. And what you can do is you can practice. You can practice with needles just in like some other type of jar or whatever, so that you can get the calculations down and be confident by the time you're using the actual product. That's a good idea. That's something I did because I have all these vials left over from when my friend actually is a doctor that helped me get started with this. And so that got me over my fear of injections or whatever, which I never really had. I always knew it was something kind of simple, but I have to do it in my back. So when you get this, throw it in the refrigerator. And then when you're ready to go for it, after a few trial runs, just do a few practice runs, according to these calculations, which I will post in the comments. Then you will have your vial of Botox here. So that will be the first thing you pull out, in addition to your sterile water. Okay, and then you want to use your 3 milliliter syringe, and you want to draw it out to 2.5 milliliters. All right, so you're going to take 2.5 milliliters from your sterile water. You're going to suck it up to around 3. Okay, so when you pull that out to around 3, tap it to get all the air out so that you can prime the needle, and then you push that up, and then you get it up to exactly 2.5. And that's just one of the calculations on the chart here, in which you can change your injections, because the larger the muscle, the more it's going to take to neutralize that muscle and get you out of pain. So once you have 2.5 milliliters of sterile water, you inject that into the rubber area on the top of the Botox vial. And then when you insert that needle into the vial, you should see the plunger automatically go and get sucked into the vial, because the vial is a vacuum. And when you see that happen, that's a pretty good sign that you've got a legitimate product, but not necessarily an ultimate sign, because it could have been overheated. They could be forging that part of it, etc. So once you've got 2.5 milliliters in there, simple math will tell you that if you draw out 5 times in equal measurements, you will have 20 units per injection. And so that's the part where you use the smaller 1 milliliter syringe to draw out 0.5 of a milliliters, and these are marked in tenths, so you would be drawing out to 0.5. And the reason you want to, after you've done this, after you've put that in there, you're supposed to wait around 10 minutes and watch some other YouTube videos that are going to go more in depth about that. Then you want to, after you've put in that, if you need to get rid of air bubbles, definitely get rid of them by putting it back into the refrigerator, which will eliminate bubbles. And then you use your pliers, and then you just slowly peel, very slowly. There's no rush here, to get that aluminum retainer off, so that ultimately you can pull the plunger on it, and then you can put this at a 45-degree angle when you're doing your draw using your needle here, because you want every last drop of this very expensive substance, and so you can end up in an angle like that. Because when you see it in the movies, doctors always draw like this, which is totally idiotic, because then you have to be so precise about your draw. That's just absolutely stupid. And so that's that. And so after you've done that, then you will be referring to this chart on your injections. So to recap, you're going to inject the vial with 2.5 cc's, depending on what you choose here for your injection concentration. Once that's been sucked up there, you switch out to your 1 milliliter injection syringe, and then you draw from the vial. And be very careful here not to spill it. Chances are you might want to have a friend help you with this. And then you draw out at a 45-degree angle, so you can get every last drop in there. And then this needle, you also want to prime that as well. Get all the air out of there, and good luck with this. It's 10 minutes.